Hi guys, my name is Sarah Townley. I'm a youth program associate with the University of Missouri Extension, and today I want to talk to you guys about identifying and handling veterinary emergencies. So this is really geared toward the 4-H Veterinary Science project, but truthfully, I think that this is a good lesson and good knowledge for anyone to have if you have animals at all, whether that is dogs or cats, or if you have livestock or horses. And we're going to talk a little bit about both. So if you are in the beef project or the sheep project, or if you're in the dog project or veterinary science, this is a good lesson for you. So really quickly, before we get into the content, I wanted to ask some questions and give you guys something to think about as we go through this presentation. So first question is, why is it important to be able to recognize veterinary emergencies? Why is it important to monitor your pet's behavior in general? What's important to know about animal behavior during medical emergencies? And lastly, what are 4 symptoms that you can think of a medical emergency that a pet might experience? What about a farm animal? Kind of think about what you know from animals that you may have, or some guesses that you might have about some of those symptoms, and we'll go through those throughout this lesson. So we're going to start by talking about dogs and cats. And so you're going to see some similarities between all the species, but dogs and cats, your companion animals, do experience medical emergencies a little bit differently than livestock or horses might. So first, some general tips for handling pet emergencies of any kind. When in doubt, it's always good to call your vet, especially during the normal business hours. If you think something is wrong, then call your vet and ask them if you just need to monitor, or if they think your pet needs to come in, and they'll kind of ask you what's going on, and they'll make a judgment call. But it is always good to keep a phone number for a 24-hour vet on hand. Now, your vet might do something like what my family's regular vet does, and they have a voicemail system set up for after-hours emergencies, and they will call you back. But of course, they don't always have someone on hand during certain times. If one of the vets is on vacation, they don't always have an emergency line available. So it is always good to keep multiple numbers for vets on hand. And if your pet isn't acting like himself or herself, don't panic. We'll talk a little bit about how animals react to pain or irritation, and what that behavior might look like a little bit later on. It's also a good idea to keep a pet first aid kit on hand. So first, a thermometer. Now, a regular digital thermometer will work, but they do make specific pet thermometers, because remember, the only way that we take animal temperatures is rectally. We don't take the temperature in the mouth. That being said, it's also good to keep some lubricant on hand, and they do sell this, I know, at my local farm supply store. So check that out. It's probably going to be a lot more comfortable for your pet if you use lubricant on the thermometer before you take their temperature. You need some bandages. What I would recommend keeping on hand is gauze, some vet wrap, tape, and when we say tape, be very careful and try to get some that's more like paper, that's like masking tape almost, paper medical tape, that's not going to pull their fur out, because you don't want to hurt your animal and pull their fur out. And cotton balls. Cotton balls are also good to keep on hand. An ice pack. Phone numbers, we talked a little bit about that. Another thing I would recommend is keeping your vaccination records somewhere handy. This can be in the first aid kit, or like for me, I have a desk drawer with files in it, and I have a file specifically that I keep my pet's vaccination and veterinary visit records in. So they're all there in one place if I need to present them or have them on hand, especially if you take them to a vet that's not their regular vet. Some medicines, these can include hydrogen peroxide. We use that to induce vomiting, and I will give you instructions a little bit later on about how we do that safely. And it's always a good idea to do that under direction of your vet. And antibiotic ointment like Neosporin. Some tools and equipment that you might want to keep on hand are some disposable gloves, like latex gloves, blunt end scissors. This is for cutting your bandaging or your tape. Tweezers for if you need to, get in and remove something like some debris from a wound. An oral syringe, alcohol wipes to sterilize your equipment before and after use, such as your scissors or your tweezers. Saline solution, contact solution will work just fine for this. A towel or a washcloth, a small flashlight, and a muzzle. It's also a good idea to keep some nutritional support in your pet first aid kit. This can be a baggie of their food, and that goes two different ways. It can go for if they need something to eat, or if you have to take it to the vet, if they ask what your pet eats. It's always good to have a baggie on hand that you can grab to show a vet some treats. And if you can find some of the little individual packs of peanut butter, that's always good for if your pet needs some nutrition, some fat, if they need to increase their blood sugar, or if you need something to distract them real quick for whatever reason. So we'll start going through some of the symptoms that your pet might be experiencing if they have a veterinary emergency. So pain, that can be a lot of different things and have a lot of different causes. But in general, if your pet is acting very restless, if they're agitated, if they're pacing around, if they just can't seem to calm down, if they're panting, if their heart rate is up, or if they're acting aggressive, especially if your pet doesn't normally act aggressive at all. This can mean they're in pain. Now, you want to try to figure out where the pain is coming from, but be careful about touching your pet. So, especially if you can see that they're limping or how they're holding themselves, you can tell where the pain is coming from. If you can do it, you might have to feel around a little bit to figure out where they're hurting, but once you figure out where they're hurting, don't touch them excessively. And if you have to take them to the vet, be careful about how you pick them up. Don't cause them any more pain when you pick them up, and be careful about how you put them in a carrier if that's how you're going to take them to the vet. So difficulty with breathing or choking, some possible causes of this are trauma, and we'll talk a little bit about trauma. This can be something, anything from being hit by a car, which can be pretty serious, or being run into or trampled by another animal. And this can be like a dog headbutting another dog or running over a cat, or it can be something like a horse or a cow kicking your dog. Or maybe they fell off the bed or fell off the back deck or something like that. Those are all examples of trauma. Allergic reactions, we'll talk a little bit about that later as well. Heart failure, toxins, infections, cancer, and that one's kind of a, yes, difficulty breathing is a symptom of cancer, but don't automatically assume that if your pet is out of breath that they have cancer. There are a lot of different causes for difficulty of breathing. Leakage of air, so that might mean like a punctured lung or an airway obstruction. So coughing and choking can actually be caused by different viruses or bacteria, fungal pneumonia, allergic bronchitis, or even heart failure. Your pet's normal breathing rate should be anywhere from 20 to 34 breaths per minute. And you can tell if they're having breathing problems if they're breathing faster than normal, especially if they haven't had much exercise, if they're really not if they're not worked up at all, if they haven't had a good workout, if they've been running, if they're having trouble breathing and they haven't really worked at all. Or if you can tell that they're in pain, like that last slide, we discussed pain, if their breathing appears to cause them pain, or if they're having a hard time, if they really have to work at it, or if it's noisier than normal. So seizures, if your pet has never had a seizure before, you need to call your vet immediately, and that's non-negotiable. There's really nothing else you can do or should do other than to call your vet, because seizures can be pretty serious. Now, if you've already taken your animal to the vet, you know they have seizures, then your vet has probably already told you how to manage these. So seizures can be a one-time thing, an isolated incident, or it can occur in clusters. And these can range from mild, maybe your pet's like zoning out or they fall over, all the way to severe where they are convulsing on the floor rather violently, and it lasts for a longer period of time. So these can be triggered by intracranial problems or extracranial problems. So let's pause for a second and think about what that means. So the word cranial means of the brain. Your cranium is your skull. And so the prefix intra means inside and extra means outside. So that means that seizures can be caused by problems that are inside the brain or of the brain, or it can be caused by problems outside of the brain. So in general, how you need to manage your pet if they have a seizure, while they are seizing, you kind of treat that the same way if you're familiar with first aid in humans, you kind of treat seizures the same way you would for a human. Just make sure they're in a safe place where they're not going to hurt themselves while they're convulsing on the floor. And also make sure that they don't have any food or drink in their mouth. And if they vomit, try to get that out of their mouth, tilt their head to the side, and don't let them choke. Difficulty urinating or defecating. So if you're not familiar with what those words mean, it's difficulty going to the bathroom, peeing or pooping. So some common causes are UTI, which your vet can probably diagnose and treat fairly simply. Kidney stones. Dogs and cats can get kidney and bladder stones just like humans can. Inflammation for whatever reason, blood clots, cancer, stress, disease of the rectum, anus, or colon, or constipation. And so some signs that your pet is having difficulty going to the bathroom might include straining really hard. They're in pain. Again, we talked about some of the signs of pain are. If they're crying or whimpering as they're trying to go to the bathroom. If you notice mucus or blood in the urine or the feces, or the complete inability to urinate or defecate. And so, yes, and if you walk your dog, or if you have a cat and you clean out their litter box, then you're probably pretty used to seeing your pets pee or poop. But no matter what, you really need to monitor. Yes, look at their pee and poop after they go to the bathroom, because you need to monitor and make sure there's not any problems with their digestive or their urinary systems. So vomiting and diarrhea, if you own pets, you probably know this is one of the most common emergencies, or the most common things that can happen to your pet. Of course, if you have a cat, sometimes they just get a hairball and they yak up a hairball. If you have a dog, sometimes they just get into something they're not supposed to, or things happen. So that's some of the most common emergencies or illnesses that your pet can have. So this can be caused by something in their gastrointestinal system, or it can be caused by something else like stress. So if you notice them throwing up or having diarrhea, if it's an isolated incident, you could probably just monitor them. If it's something you notice happening multiple times a day, or especially with vomiting, if it happens multiple times within like a 1 to 2 hour period, you probably need to call your vet. Just make sure they don't get dehydrated, monitor their symptoms, notice if they have any other symptoms that go along with the vomiting or diarrhea, like pain or shortness of breath, because this can be a sign of poisoning. And we have an entire slide dedicated, here a couple slides down, dedicated to different poisonings and how to identify that. So just know that vomiting or diarrhea can be a sign of different kinds of poisoning. All right, so we mentioned trauma a little bit when we talked about pain. And again, this can be something like being hit by a car. One of your other pets might play rough with your dog or cat. If they fell off something, if they ran headfirst into something, things happen, pets injure themselves. Sometimes they play too hard and they don't realize what they're doing. So it does make it a lot easier if you saw what happened. If you saw your dog run into the street and be hit by a car, if you saw another dog run over them or whatever it is that happened to them, then you know how hard they were hit, how serious it is, where they were hit, and that kind of thing. So you can kind of gauge what the issues might be and what to tell your vet. Is the animal showing visible signs of pain? And if something happens to them that you think could cause them internal injuries, that can take hours to manifest itself. And so while you might notice that they are in pain or having issues, it might take several hours to manifest things that could be life-threatening. And so as far as broken bones go, there is, under the livestock section that we're going to talk about in a little bit, we'll talk about treating broken bones and splinting them and so on and so forth. And so for poisoning, as far as dogs and cats go, things usually that you find around the house are going to be what they are going to be poisoned by. So, of course, mouse and rat poison, that can go for dogs or cats, whether they get into the actual poison itself, if it's left out, or if they eat a mouse or a rat that has been poisoned. Either way can poison them. Household cleaners. And another thing with that is if you clean your dog or cat's dish with bleach and you say leave it somewhere where they can find it, they can drink that cleaner. Medications, there are actually a lot of different ways that pets can be poisoned by medications. You might be thinking of like human medications, like if you, for example, spill ibuprofen all over the floor and your dog licks it up. That is one way that your pet can be poisoned by medication. They can also be poisoned by their own medication if for some reason they get into a medication that is intended for them and they overdose on it. And another way is that they can get into medications that may be intended for another animal, or they can be given or unintentionally run into something that is for another species. For example, flea and tick medications that you apply to the skin for dogs are actually toxic for cats. Another example of this is that certain dog breeds, this is usually herding breeds like collies or healers, are actually deathly allergic to ivermectin. And so this can be if someone who doesn't know intentionally gives their dog ivermectin to worm them because they don't know that it's toxic. This can be if your dog happens to get into some ivermectin that was laying around that you're going to give to say a horse, or if a dog, for example, eats some poop from a horse that was recently wormed with ivermectin. These are all ways that that dog can be poisoned. So just to be aware that some dogs are allergic to ivermectin, and these are different ways that animals can be poisoned by medicine. Pets can eat plants such as lilies or poinsettias. Those are toxic to plants. Batteries, those are actually, pets can ingest batteries and those are toxic. Antifreeze, I personally don't know what antifreeze tastes like, but somehow through research and different accounts, we know that antifreeze tastes sweet. And so pets love to, say if it's on the floor of the garage or the driveway, they like to lick it up, and that is toxic for them. Insecticides, so if you have any kind of chemical around to kill bugs around your house, that can be toxic. Paint, of course, we know that chocolate is toxic to dogs and cats. Xylitol, which is a sweetener that can be found in things like peanut butter, and that's toxic for pets, as well as fertilizer. So if you think your pet has been poisoned, call the Animal Poison Control Center immediately. The number is on the slide. And if you can, if there's someone else around, have them call the vet while you deal with what your pet is experiencing. So according to the AKC, you can actually administrate hydrogen peroxide to induce vomiting in your pet in certain situations. So it needs to be 3% concentration of hydrogen peroxide. Anything higher than that is going to be toxic if your pet ingests it. So the proper dosage is around 1 teaspoon per 5 pounds of your dog's body weight by the mouth. So use an oral syringe and administrate that. Have your dog ingest it. They need to swallow it with a maximum dose of 3 tablespoons for dogs who weigh more than 45 pounds. Ask your veterinarian about the best dosage for your dog, and only induce vomiting if your dog ate the substance within 2 hours. Additionally, there are certain circumstances where you don't want to induce vomiting for your dog. For example, if they ate something like a chemical or batteries or something that is caustic and is going to burn them, you don't want to induce vomiting and have it burn their esophagus on the way back up. Another example is if your pet has ingested something and they are unconscious. You do not want to induce vomiting if your pet is not conscious. So allergic reactions can be caused by a variety of things. This can be caused by a vaccination they've had that maybe they're sensitive to. It can be caused by an insect bite or sting. They can have an allergic reaction to like a bee sting. If you've probably seen pictures online of dogs that have eaten bees and got stung in the mouth. Or a variety of other factors. Actually, pets, you may know, can get seasonal allergies just like humans can. They can get hay fever. So symptoms of allergic reactions can be swelling of the face, hives or itchiness. They can include vomiting or diarrhea, lethargy, or difficulty breathing. And so with acute allergic reactions require immediate veterinary care. And you may be familiar with the term anaphylaxis. That is whenever a animal or like a human has an allergic reaction that swells up the throat and cuts off the airway. That is very serious, and you do need to call your veterinarian and get them care immediately. So actually, both dogs and cats can take Benadryl to help curb the symptoms of allergic reaction that they're facing. So if your pet is 30 pounds or smaller, well, I guess I better start by saying the most accurate dosage is going to be anywhere from 2 to 4 milligrams per pounds of body weight. But Benadryl comes in different dosages, especially like pills of Benadryl. So the best guess or the most accurate dosage is that dogs or cats 30 pounds or smaller can take 10 milligrams per dose. If they're 30 to 50 pounds, which that would just apply to dogs, then they need to take 25 milligrams per dose. If they're over 50 pounds, then they need to take 50 milligrams per dose. You should consult your veterinarian if possible, and there are certain conditions according to the AKC that that Benadryl should not be administered under. So those can include, and a lot of these are pretty specific diagnoses, but if your pet has one of these, then you'll know. So those include angle closure glaucoma, severe heart failure, prostatic hypertrophy, bladder neck obstruction, seizure disorders, which we talked about a little bit earlier, hypertension, allergic lung disease, or pregnancy. So the last slide that we have under pets like dogs and cats is open wounds. And these can be caused, like trauma, by quite a number of things. And if you've owned pets very long, you know that there are a lot of ways that dogs and cats can hurt themselves. So dog bites are a pretty common one. And there are other lacerations that your pet, they can really cut themselves on anything. Like if you have outdoor dogs, barbed wire is a big one, or just a lot of other things within your house. So the biggest thing with wounds, of course, if they're serious enough, which would require immediate veterinary care, bleeding is an issue, but also you really want to care for wounds because they can introduce an infection into your pet's body, which can cause a lot of other issues. So one wound, even if it's not that serious itself, can cause a number of conditions that can be life-threatening. So if your pet has a laceration in the chest or abdominal cavity, this can be life-threatening. So any severe wound or a wound that's in one of those places is going to require immediate care. So as far as administering first aid, we talked a little bit about pain and how if your animal is in pain, it may act in an aggressive manner that it normally doesn't act. So for example, your dog might not ever snap at you, bite you, or growl at you, but it could do this while it's in pain. And don't take too much offense to that because your dog doesn't necessarily know that you're trying to help it and not to hurt it. Or your cat might try to bite you or scratch you, and that's just how it's reacting because it hurts. And if you touch your pet and you hurt it, it doesn't necessarily know that you are trying to help it. So in order to kind of restrain your animal and keep you from getting hurt and to keep them from hurting themselves, you may need to muzzle your dog or to wrap your cat in a towel so it cannot scratch or bite you. If it's necessary, you may need to shave some of their fur from the area of the wound, wash it with warm water, apply the ointment, the Neosporin or antibacterial ointment to the wound. It's best if you can avoid bandaging it, especially very tight, so it kind of gets some airflow to it, but avoid allowing your pet to lick the ointment off. If you need to put a coat on them or leave the muzzle on them for about 10 minutes so the ointment has some time to do its job, you can do that. Or you can apply a loose bandage. And again, if you have a large wound or one that's bleeding profusely, apply pressure with a bandage until you can get the animal to the vet. And that's where those rolls of gauze, if you buy the gauze that comes in the rolls, and the rolls of self-adhesive vet wrap come in handy. All right, so now that we've covered how to deal with emergencies that you might experience in dogs and cats, we'll move on to how to deal with emergencies you might experience if you have horses, cattle, pigs, sheep, goats, or other animals on the farm. So some general tips for handling farm emergencies. Livestock are a lot less sensitive to certain ailments than dogs or cats. So you'll notice a lot of similarities with some of the things that livestock or horses might experience, but they're not going to be quite as sensitive. Another thing, a way that they differ from dogs or cats is that livestock are more dangerous to handle. First of all, they are bigger, they are stronger. Horses and cattle can kick. And they also are not, although especially like horses, you do train horses and have a relationship with them. Cattle or pigs, if you're showing them, if you have a show animal that you're working with, they might have a relationship with you a little bit more like a pet. But a lot of times livestock don't quite understand quite as well as dogs or cats can. So that whole aggression thing we talked about, livestock can become pretty dangerous whenever they're sick or in pain. So we talked about a first aid kit that you can keep on hand for your dog or your cat. The same thing applies with livestock or horses. However, you'll notice in this list that there are some different things that you need to keep on hand. So a thermometer and a stethoscope. Again, this is the same thing as dogs and cats. Temperature can only be taken rectally for livestock. You can't take their temperature through their mouth. So again, you see lubricant further down there on the list. You're going to want that for taking their temperature as well as some other things. Phone numbers for your vet, and always keep a number on hand for a vet who will make farm calls after hours. Because if you're like me and you've owned livestock or horses very long, you know that a lot of times that's whenever they decide to hurt themselves or to have problems giving birth or so on and so forth. That's always when it happens. You also want to keep some bandages like the ones we discussed, gauze or vet wrap, like with dogs and cats. You also want to keep the disposable gloves. So not only you want to keep like latex gloves on hand, but you're also going to want to keep the full arm length gloves on hand for if you have to reach up inside the vagina or the rectum, especially if you are helping an animal that is having problems delivering babies. You also want to keep medicines on hand. And this can usually for livestock or horses includes things like Vetricin. You want to keep a clean stainless steel bucket on hand, hypodermic and intravenous needles, as well as syringes, obstetric chains and handles, lubricant we already mentioned, a nose suction bulb, a flashlight, which is vastly more important here than it is for dogs and cats, because sometimes you might be heading out into the field at night and you want to try to find where your down animal is. Also, if you can keep a mini fridge in your barn to keep things like medications in, that's always good as well. So with open wounds, again, livestock aren't quite as sensitive as dogs or cats are. So really what you're going to do is just make sure you clean the wound with water and then apply some type of antiseptic like betadine or Vetricin. Apply pressure using a gauze roll, especially on the legs. This is good to wrap it around their legs, and then secure it with that self-adhering vet wrap. Now, if your vet does need to travel, or if your animal does need to travel to the vet, try to keep them immobile during transport while they're in the trailer, or until the vet can make it to your location. And again, we kind of discussed that livestock can be more dangerous than dogs or cats to deal with. So keeping it immobile might not mean keeping it completely still. This just might mean if the best you can do is getting it up out of the field and getting it into a stall or a pen, by all means do that. Keep it as immobile as possible and make it to where when the vet gets there, they can treat it and you're not still chasing it down. So trauma, we talked a little bit about trauma and broken bones with dogs and cats. If it is a leg, you want to try to immobilize that leg, and your animal can have trauma or broken bones from being kicked by another animal, being trampled by another animal, which is especially true of baby animals. They can have broken bones as a result of birthing issues, stepping in holes, being hit by a car, or a number of other situations. And again, if you've owned livestock or horses very long, you know that they find all kinds of different ways to hurt themselves. So if you know your pet or your livestock animal, your cow, your sheep, whatever it is, has a broken bone, try to splint that leg. If it's a break in the leg, which it usually is, that's more common than anywhere else. You can use cotton and bandage to splint the wound. That will work in a pinch, but if you have something rigid to splint that wound with, that works best. And so when you splint a wound, you want to immobilize the joints on both sides of a break. Actually, PVC pipe and gauze roll can make a good splint if that's what you have on hand. So if your animal has any kind of broken bone, you want to transport that animal to the vet as soon as possible. Now, as far as transporting your animal to the vet versus a farm call, transporting that animal to the vet is going to be your best case scenario because they have the equipment and supplies on hand to treat that better than they can out at your farm. So severe fractures or open fractures are very severe and require immediate veterinary care. And as you probably know, severe fractures of the leg are usually, they usually have a poor prognosis, especially with horses, because that can either mean the end of a riding career for a horse or even euthanasia. So for breathing trouble and airway obstruction, there are a number of different things that can cause this. So the first example is bloat, which we'll talk a little bit more about in our section under gastric issues. This is something that's pretty common in cattle. And what bloat is an excessive buildup of gas, which this condition can be fatal in 6 to 12 hours. This is going to require your vet to come out and use a trocar and cannula to relieve that gas buildup. In neonatal animals, this can be because they have excess fluid. That fluid from being in the womb can get in their airways. One good way to take care of this is to take the newborn baby and hang them upside down from their back feet. And that's also what you keep that neonatal bulb on hand for, so you can suck the fluid from their nose and mouth. Breathing trouble and airway obstruction can also result from bacterial infections, viral infections, respiratory diseases, anaphylaxis. We talked a little bit about anaphylaxis. It can also occur as a result of parasites or weed poisoning, which we'll talk here in a few slides about different plants or weeds that your livestock or horses can get into that are toxic. Signs of breathing trouble or airway obstruction in your large animal or horse could include heavy or labored breathing, being winded after exercise. And this is kind of like we talked about with dogs and cats. This is if they have done something simple like running just one time across the pasture or coming up to a feed bunk. This is not like if you've given your horse a hard workout for half an hour or an hour, because it's going to be kind of normal for them to be winded. But if they haven't done very much, if they haven't exerted very much effort and they are just panting and winded, that is that's a sign that something's wrong. If you notice mucus or pus coming from their nose, if you notice weight loss, weakness, lagging behind the herd, or death. Now, if death is something that has happened to an animal, then they're probably not going to need any of the tips in this presentation. But if an animal died and you've noticed it experiencing any of these symptoms, then that might be an indication that they had something that they could spread to the rest of the herd. So you need to be extra vigilant. You need to quarantine the affected animal or animals so they don't spread something viral to the other animals in the herd, and then call your veterinarian. So next, gastric issues. There's two different slides on this one. I actually dedicated this whole first slide to colic in horses because this is something that can be pretty common or something that anyone who owns a horse needs to watch out for because it can become quite serious. So colic is actually not an actual disease or condition. Basically, colic just means gut pain, and it can actually mean several different things. So it can mean a twist in the intestine, it can mean an impacted or blocked intestine, it can mean some part of their gastric system, like the colon or small intestine, has been stretched, a number of different things. So some symptoms that your horse is colicking might include frequently looking down at their side, biting or kicking their flank or their belly, lying down, rolling, if they're not pooping or if they're not pooping as much as they normally do, if their poop is smaller than it usually is, if you notice that their poop is more dry or it's slimy and mucousy, either of those extremes, poor eating, and well, let me back up a minute. We talked about watching your dog or cat's poop and kind of monitoring that because that can be an indication of something being wrong. The same thing applies to your horse, especially if it's stalled, where you can kind of monitor what their poop looks like. Keep an eye on that because it can be an indicator if something's wrong, and you might be able to catch a condition earlier and be able to treat them earlier. Some other symptoms of colic include poor eating. They don't eat all their hay or grain, change in their drinking behavior, heart rate that's higher than normal. And a normal heart rate for a horse is 45 to 50 beats per minute. If their gums are tacky, meaning they're kind of dry, so if you touch them, they're stickier than normal, they're not covered with saliva. Long capillary refill time. And how you can test this is you can open your horse's mouth if it'll let you and press on their gums. And when you press on the gum, it's going to turn from like a pink color to a white color. The longer it takes that spot where you pressed to return to the pink color, that's a longer capillary refill time. And off-color mucous membranes. This includes their gums, like we talked about, as well as around their eyeball. So if those mucous membranes are kind of whitish or grayish, that's a bad sign. And as soon as you notice any of these signs of colic, you need to call your vet. While you wait for the vet to come to your location, try to walk your horse and prevent them from rolling, because walking your horse can sometimes provide them with some relief. Some other gastric issues that you might notice in some of your other large animals, like your cattle, sheep, goats, pigs. Bloat, we talked a little bit about that, that it's an excessive gas buildup. Some symptoms of this can include distension of the left side of the animal. That's a primary sign. Discomfort indicated by stomping feet, kicking at the belly, labored breathing, frequent urination and defecation, and sudden collapse. Diarrhea is also, it can be pretty common, but that's an indicator that something is wrong with the gastric system in a lot of livestock. And this can be caused by a number of things. It can be caused by nutritional issues, such as too much green pasture can make them have diarrhea. If they have a deficiency of some type of nutrient, copper deficiency or toxicity. If you own sheep, you know that copper is toxic to sheep. That can be an issue. It can also be caused by infections such as parasites, viruses. In cattle, this is an example of this is BVD, bovine viral diarrhea. In hogs, this can be caused by PED, porcine epidemic diarrhea, which is a very serious condition that can be spread very rapidly, or it can be caused by bacteria like salmonella. It could also be caused by diseases like liver disease, heart failure, chemical poisoning, plant poisonings, things like that. So actually, fun fact about PED, according to Merck Animal Health, PED is viral, and it's actually a coronavirus. And this is not related in any way to the novel human coronavirus, and it does not spread to humans. So, but fun fact, PED is a coronavirus. One issue if you raise animals and you breed animals like horses or cattle, birthing trouble can be a serious issue that could cause both the death of the offspring or of the mother. So it's always a good idea to keep obstetrical chains and a calf jack on hand. And how you know that your animal is having issues giving birth is different depending on what the species is. So for horses, if your foal does not present within 5 minutes of normal placenta rupture, call your veterinarian immediately. For cattle, if the water sac appears and labor continues for 2 to 3 hours with no birth, confine the cow for examination. For pigs, if the time between each pig birth exceeds 1 hour, examine the sow for stuck or multiple pigs, because multiple piglets, well, as you may know, most sows, depending on the breed, can give birth from anywhere to 8, 12, 14 pigs in one litter. And so you might have multiple piglets that have come into the birth canal at the same time and become stuck. For sheep, if a ewe has been straining over 1 hour, confine her for examination. And for goats, if labor lasts longer than 30 minutes with no kid, confine that doe for examination. And so you do want to check the fetus for what presentation, how that fetus is coming out, what part of it's coming first. Some incorrect presentations you may be able to correct on your own, but some may require the assistance of a veterinarian. Also keep in mind that sometimes animals, this is particularly true of horses, do prefer to be left alone. Interference can interrupt their giving birth and can stress them out. So it's always best, if you know that that animal is going to give birth, you might want to keep them up closer to the house, in a closer pasture or paddock, or even in a stall or pen, but kind of leave them alone and just keep an eye on them. And then if you notice them having trouble, that's when you need to step in and intervene. Also, as far as horses go, a foal can die within 45 minutes of the beginning of the delivery. So sometimes if you are in doubt, it is best just to call your veterinarian, but just keep in mind that things can progress very quickly and situations can turn bad very rapidly. So it does vary from species to species, but this presentation that you see right here is what we call the normal anterior presentation. This is what your ideal or most correct presentation, particularly in cattle and horses and sheep. So you want those front feet to come out first and then followed by the head, and you want the animal's head to be where the eyes are up towards you, and you want the nose coming out first. You want that animal's head right side up. Posterior presentation, you can deliver them if they are coming out back feet first. Just monitor them, but they'll often come out and be just fine. That presentation on the right, if they're coming out butt first, depending on the species, for calves anyway, you can push them back in, grab the back feet first, and make sure that's how they're coming out. I also do want to mention the normal presentation for pigs is normally that their head actually comes out first, followed by the front feet facing backwards. And it is a little bit different for sheep and goats because they often give birth to multiple litters, twins, and for sheep, sometimes triplets. And so it's not at all uncommon for one twin to come out head first and one to come out back feet first. But again, just keep watch over them and make sure that they're not coming out what is called breech, or that where their backside is coming first and you're not seeing their feet. And so again, if their backside is what's coming first, if you have a glove on and you can feel that, push that animal back into the uterus and pull those feet out to where they're coming first. And again, I'll say this reminder over and over, if you are in doubt, you do need to call your veterinarian. It's better not to chance it. But I'll make another side note and say, if you come from a family, kind of like me, if you come from a farming family where your mother and or father have raised that certain species of animal for a number of years, listen to them because they probably know what to do. But if it's the kind of situation where you are raising an animal to show for 4-H or raising it for your 4-H project, and your mom and dad let you have one, but they don't necessarily know a lot about that animal and how to raise that animal, you do want to call your vet. Don't take any chances with the lives of your animals. So this position is what's called anterior sitting dog. This can quickly result in fetal death. So if both of the feet are coming forward, back feet and front feet, you're probably going to need the help from your vet. That is what I would recommend. So don't take any chances, call your vet. In this anterior presentation, this is where the front feet are coming out first, but the head ends up stuck backwards like that, so that animal cannot come out of the birth canal. So your best bet, and again, call your vet if you're unsure, but you can secure those front feet with chains. So you have control of those and you have a hold of those feet. Secure them with the chains and then push the calf or animal. This is pretty common with sheep as well. Push that calf or that lamb back in. And this will often correct the head to where you can pull the front feet and then that head out in the correct position. In this position, posterior presentation upside down. Never attempt delivery with this one, always get professional help. Another side note is if you have that, the front feet and the head presenting, and again, all of these images come from Texas A&M Extension, and this is how to deliver a calf. It does vary a little bit with, again, like sheep and goats, but if that calf is presenting feet and head first, but that head is in that vertex position, it likely means that the calf is deceased, because a live calf will often have the ability to move around and correct this. Now, it is likely an indicator of deceased calf. It is possible that the calf has been so stressed out from a hard birth that it's tired, but again, live calves usually can move and correct this head position to where their head is facing forward. So again, some additional tips for handling birthing problems. If you have gotten that animal up and you have assisted them for 30 minutes and not had success, it is absolutely, without a shadow of a doubt, time for you to get professional assistance. But if you live in an area like I do, it's going to take at least 30 minutes for your vet to get there for a farm call. So pretty much the time that you're waiting for the vet to get there, you're going to be assisting that mother. Multiple births. This occurs more with sheep and goats because they have those long gangly legs where pigs really don't. But watch out for entangled limbs and make sure you know which baby is which and get them out one at a time. And if you have multiples coming out at one time, you're going to have to push both of them back in and deliver one of them. A detached placenta and cut it out immediately and pull the fetus. A ruptured uterus, you'll know if that has happened for whatever reason, trauma, stress, because the mother will be sick after the delivery. So, and you kind of want to, especially if you have to assist with any delivery, you do want to monitor the mother and baby for the few days after that to make sure everything's okay. Ruptured uterine artery, you really won't know that that has happened usually until the mother is deceased. And it's going to be hard for you to recognize this if you have assisted the mother in a delivery without a vet's help. If the pelvis is too small or any tearing, hemorrhaging, or prolapse occurs, call the vet immediately. And actually, our next slide is talking about prolapses. So we talked a little bit about birthing difficulty. In any of these types, vaginal or cervical prolapses, uterine prolapses, or rectal prolapses can happen as a result of pregnancy or birth, especially in your older cows or older animals. I guess I keep referring to cattle because that's what I know best because I was raised with cattle. An older mother animal is more likely, you might notice this more because they've given birth to multiple animals and they have a weakening of their pelvis. Of course, rectal prolapses can happen alone as a result of digestive issues or diseases. If a prolapse occurs, you want to call your vet immediately. So, of course, if you have an organ or part of an animal's body that is supposed to be inside their body that's extending outside, that's an issue, but this really creates an issue because it introduces the possibility for infection to get into your animal's body, which again, infection can cause a whole host of other issues that can be serious and even cause death. So one of the last couple of things I'm going to talk about when it comes to livestock is plant toxicity poisoning. I'll move through this rather quickly. You may have the handout, if I've provided it to you, the handout that has all the pictures on this. You can go back over this later. One way to prevent your animals from experiencing plant toxicity poisoning is to always make sure you have them grazing in pastures with plenty of good grass, or if you're feeding them some type of something else like hay or grain, just make sure they're not hungry and they're not foraging and eating things that they shouldn't out of necessity. Any severe plant poisoning is going to require the care of a veterinarian. You might recognize this one. Any type of hemlock is going to be poisonous to all of the species of animals we've kind of talked about. It'll cause foaming in the mouth, dilated pupils, diarrhea, convulsions, respiratory failure, or even death. Pokeweed, you might recognize these. These are those fun purple berries that kind of stain everything if you squish them. This affects cattle and pigs, and this will cause retching spasms, vomiting, purging and convulsions. Marsh marigold, this one is toxic to bovine. It can cause those symptoms that are listed on the screen. I won't read all of them. Buttercup is actually toxic to cattle, horses, sheep, and goats. And one way that you'll know that your animal has been into buttercup is if their mouth is kind of irritated. It causes blisters in the mouth and drooling. And as a result of that, they are not going to want to eat because their mouth is irritated. Wild cherries, which grow on trees, those are toxic to cattle, horses, pigs, sheep, and goats. That causes breathing problems, and animals tend to go down with their head turned to one side. Nightshade is very, 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 very toxic to all species of livestock and as well as horses. It'll cause abdominal pain. We say stupidity in quotes. That kind of means like if they're out of it and they're kind of acting really weird, like they don't know what's going on. Pupil dilation, loss of appetite, diarrhea, loss of muscular coordination, unconsciousness, or death. And so here's some pictures of the flowers and the berries of a couple of the most common varieties of nightshade. There are more varieties than just these two, but you'll probably recognize that variety on the right. You've probably seen that before. You've also probably seen this one. This one's called Jimson weed. This one affects cattle, horses, sheep, and goats. It can cause pupil dilation, impaired vision, nausea, loss of muscular coordination, trembling, tainted milk, violent, aggressive behaviors, just a number of symptoms. You've also probably seen this one, probably more often if you have like horses or sheep. This gets caught in their hair a lot. Cockaburs, these are toxic for cattle, horses, pigs, and sheep, and it causes those symptoms that are listed out on that slide. And the last plant that you're probably going to see pretty commonly in your pastures is pigweed. It affects all varieties of livestock and horses, but it affects cattle and pigs more severely. It causes breathing problems, trembling, weakness, abortion. And really quickly, you usually hear the word abortion when we're talking about controversial human issues. And usually that refers to what we call an elective abortion. But anytime that we're talking about that in animals, what we're referring to is what you might be familiar with as a miscarriage. Any kind of stress or injury or poisoning that causes what we call abortion. Essentially, it causes a mother to become so sick or stressed out that her pregnancy is terminated and she miscarries the baby. So that's what we mean by abortion. It can also cause coma or death. And so the last issue that you might need to be familiar with is in your horses or ponies, laminitis, which is also known as founder. This used to be a condition that was associated with overweight ponies, but now we know that this condition can occur in any horse or any pony of any size or any age. And how you might notice that your horse is experiencing this, well, really quickly, you can look at that diagram on the right and see kind of what it looks like, that bone that is in the hoof is going down and causing pain and pushing on the hoof. So your horse will stand differently to avoid putting pressure on the foot that is affected. You need to watch for odd hoof changes such as odd ring growth, larger white, more flaky than normal. It can also cause increased heart rate and respiratory rate. A normal heart rate for your horse would be 60 to 120 beats per minute, and normal breaths per minute are 80 to 100. So if it's anything higher than that, that can be an indicator of laminitis. This is a condition that you want to call your vet immediately for. And I just now realized that I typed that twice on the screen, but this requires immediate veterinary care. And as you wait for your vet to arrive, try to avoid making your horse move, ice the foot, and give them an NSAID pain reliever. So let's take a look at those questions that we kind of answered to ourselves at the beginning, and I'll walk through them with you. Why is it important to be able to recognize veterinary emergencies? Well, of course, you want to be able to be kind of attuned to these symptoms that we've talked about throughout this lesson, because the earlier you notice that something is wrong with your pet or your horse or your cow or whatever it is, the sooner that you can get them help And oftentimes you can avoid a more serious condition if you catch something early. So why is it important to monitor your pet's behavior in general? Well, we kind of talked about what might happen if your pet was in pain. They might act in a way that they don't normally act. And so if you know what your pet acts like kind of in general, you can be, I guess, more in tune with and be more sensitive and know whenever they're experiencing some type of pain, irritation, sickness. So then a follow-up question is, what is important to know about animal behavior during medical emergencies? Well, whether it's a pet and they become aggressive and are biting or clawing, or whether it's a large animal and they are becoming flighty or irritated, you need to be aware that an animal is going to act in a way whenever it's in pain that could hurt you. And if it's your dog or cat, don't be too afraid and think that they're being mean to you or that they don't like you. They just don't understand and they're in pain. So just be aware of that. And lastly, I'm going to let you think through this one and then I'll list some of the answers. What are 4 symptoms of a medical emergency that your pet might experience? Okay, so some examples of the things that we talked about are pain, trouble breathing, vomiting, diarrhea, seizures, trauma, broken bones, and there are several others, but those are just some examples that you might have thought of. What about farm animals? So they're going to experience maybe some of the same things that your pet might experience, like, of course, being in pain or digestive issues, even though those might look a little different than your dog or your cat. They could also experience trauma, broken bones, difficulty breathing, and some, of course, birthing issues. You might experience some birthing issues with a dog or a cat, but I think it's going to be much more likely you might experience this if you have farm animals because not everyone breeds dogs or cats. If you have any questions, feel free to direct them to your project leader, whether that's for vet science or maybe that's your beef project leader, your dog project leader, or you can contact your local extension office. Thank you guys so much for watching. I hope that this helped you out with being able to identify if your pet or your livestock are experiencing veterinary emergencies.